Rhinosinusitis, it's a mouthful, isn't it? But what exactly is it? Simply put, it's an inflammation or swelling of the sinuses and nasal passages. These passages, normally filled with air, can become blocked and filled with fluid, creating a breeding ground for germs and leading to infection. It's a common ailment, but understanding it is key to managing it effectively. So, what triggers this inflammation? Rhinosinusitis can stem from a variety of causes. Viral infections like the common cold are often the culprit, but bacteria and, less commonly, fungi can also be responsible. Allergies, particularly seasonal allergies to pollen or dust mites, can contribute significantly by causing inflammation and nasal congestion. Structural problems, such as a deviated septum or nasal polyps, can also obstruct airflow and promote sinus infections, and even certain underlying health conditions, like cystic fibrosis or immune deficiencies, can increase your risk. To understand rhinosinusitis, we need to delve into the inner workings of the sinuses. Normally, the sinuses are lined with a mucous membrane covered with tiny, hair-like structures called cilia. These cilia constantly sweep mucus towards the nasal passages, removing debris and pathogens. When the sinuses become inflamed, this delicate system is disrupted. The inflammation causes swelling, blocking the sinus openings, or ostia. This blockage prevents proper drainage, leading to a buildup of mucus. This stagnant mucus becomes a perfect environment for bacteria, viruses, or fungi to thrive, triggering an infection and worsening the inflammation, creating a vicious cycle. Rhinosinusitis is a widespread condition affecting millions worldwide. Its prevalence varies depending on the region and time of year, often peaking during allergy seasons and cold and flu season. Acute rhinosinusitis, typically caused by viruses, is extremely common. Chronic rhinosinusitis, lasting for 12 weeks or more, is less frequent but still impacts a significant portion of the population, affecting quality of life and leading to substantial healthcare costs. The signs and symptoms of rhinosinusitis can be quite varied. Common symptoms include nasal congestion or stuffiness, a runny nose, which may be clear yellow or green, facial pain or pressure, especially around the eyes, nose, and forehead. You might also experience a decreased sense of smell or taste. Other symptoms can include headache, cough, fatigue, bad breath, and even ear pain. In children, irritability and difficulty feeding can also be indicators. Diagnosing rhinosinusitis typically starts with a thorough physical examination and a review of your medical history. Your doctor will likely examine your nasal passages and may palpate your sinuses to check for tenderness. In some cases, further testing might be necessary. Nasal endoscopy, where a thin, flexible scope of the light is inserted into the nasal passages, allows for a direct visualization of the sinus openings and any abnormalities. A CT scan or MRI can provide more detailed images of the sinuses, particularly in cases of chronic or recurrent infections. Allergy testing may also be considered to identify potential triggers. Rhinosinusitis can be classified based on its duration and severity. Acute rhinosinusitis typically lasts for less than 4 weeks and is often caused by a viral infection. Subacute rhinosinusitis lasts between 4 and 12 weeks. Chronic rhinosinusitis, as we've mentioned, persists for 12 weeks or longer, even with treatment. Recurrent acute rhinosinusitis refers to experiencing 4 or more episodes of acute rhinosinusitis within a year. Treatment for rhinosinusitis aims to reduce inflammation, relieve symptoms, and clear any infection. For acute viral rhinosinusitis, treatment often focuses on symptom relief with over-the-counter pain relievers, decongestants, and nasal saline rinses. In cases of bacterial rhinosinusitis, antibiotics may be prescribed. For chronic rhinosinusitis, treatment may involve nasal corticosteroids to reduce inflammation, antibiotics, antifungal medications if a fungal infection is suspected, and potentially sinus surgery in severe cases to improve drainage. Allergy management, including antihistamines or allergy shots, is also crucial for individuals with allergy-related rhinosinusitis. While you can't completely eliminate the risk, there are several steps you can take to prevent rhinosinusitis. Practicing good hygiene, such as frequent hand washing, can help prevent the spread of viruses. Avoiding known allergens can reduce inflammation. Using a humidifier can keep nasal passages moist. Avoiding smoking and secondhand smoke is also crucial, as these irritants can damage the sinuses. And managing underlying health conditions, such as allergies or immune deficiencies, can help reduce your susceptibility. The prognosis for rhinosinusitis is generally good, particularly for acute cases. Most people recover fully with appropriate treatment. However, chronic rhinosinusitis can be more challenging to manage and may require long treatment and lifestyle adjustments. Recent research is focusing on developing new and more effective treatments, including targeted therapies that address specific inflammatory pathways. Studies are also exploring the role of the microbiome in sinus health and potential strategies to restore a healthy balance of bacteria in the nasal passages. Understanding the complex interplay of factors contributing to rhinosinusitis is paving the way for more personalized and effective treatment approaches in the future.